Good afternoon, good morning, good evening, where you might be. It's 3 o'clock, and today is Tuesday, the 28th of October 2025. We have come again with our webinar series, and today the webinar that we are going to have is going to be focusing on a whole community approach to child protection. And we will be specifically talking about the SAFE program that was implemented by Bantwana, that was also evaluated by the AfriChild Centre. So we have panelists who have a range of experience and expertise that will be taking us through the different areas for this discussion. Just to run through the program, we are starting now, and we are going to start with the video about the AfriChild Centre, which will take us about 5 minutes. And then I will introduce the panelists or the speakers. And then after that, we will have the first speaker who will talk about Bantwana, telling us who Bantwana is and what Bantwana does. And then in the same order, we will have another speaker tell us about the SAFE program, the whole community approach to child protection that I've mentioned. And then the AfriChild team thereafter will come in to talk about the outcome study and findings on the Building Safe Communities program, or the SAFE program, its journey to reducing violence against children in Western Uganda. And thereafter, we will have our policy maker who will also tell us about her experience, but also how the program relates to government programs, and also what the practice is when it comes to parenting in reduction of violence against children in the country. We will wrap this up with a Q&A session, which will take us about 15 minutes. And then we wrap up and close. We will have some announcements from the center on when we expect another webinar to happen and what that webinar will look like. My name is Alex Arinitwe. I work as a research coordinator at the AfriChild Centre, Uganda, and I'll be moderating this discussion. Glad to have you. So I'll invite the AfriChild Secretariat to play for us a video about the AfriChild Centre. Over to you, Clinton and Emma.
Welcome to the AfriChild Centre, where we strive for an Africa where children's well-being is realized for sustainable development. The AfriChild Centre exists to generate research that informs policy and practice for the well-being of children.
Established in 2013, the AfriChild Centre exists to improve the lives of children across Africa. As an institution, our vision is to see an Africa where child well-being is realized for sustainable development. We recognize that across Africa, and specifically sub-Saharan Africa, children continue to face challenges across the domains of child health and survival, child protection, child development, and child participation. And as an institution, through research, our mission is to generate evidence that will improve practice and policy. We do this through rigorous research, capacity building, with an intention of building a cadre of researchers across Africa that will contribute to generating evidence to improve both practice and policy. But we are also intentional on our engagement at policy level, ensuring that research is undertaken with the intention of improving our legislative and policy frameworks. We are keen on partnerships. We believe that we cannot do this alone. We need to work closely and in collaboration with like-minded organizations, with partners, communities, and more especially with children involved in echoing and sharing the aspirations and the vision.
Join us in our mission to transform the lives of children across Africa. Together, we can make a lasting impact. To learn more about the AfriChild Centre and how you can support our work, visit our website or follow us on social media.
Thank you very much, the Secretariat, for playing that video. Really awesome hearing about what AfriChild does and how AfriChild strives to connect research, policy, and practice, and bridging the gap, which we know that it has been quite a challenge in the history of research and especially on uptake. So allow me to introduce my discussants, my panelists today and discussants for the day. And first is Madame Susan Kajura. Susan Kajura is an innovative leader with over 20 years of experience in designing and managing programs that support vulnerable children and youth. She has played a key role in developing integrated care models that improve access to health and education by coordinating efforts across communities, civil society, government, and the private sector. Since leading Bantwana's first programs in Uganda and Zimbabwe in 2006, Susan has spearheaded large-scale initiatives, including the Better Outcomes for Children and Youth, and the Safe at All Times for Every Child, or the SAFE program. She has also been instrumental in transitioning Bantwana Initiative into an independent entity in 2023. With expertise and adaptive management and capacity building, Susan remains deeply committed to her strengthening services for children and caregivers, inspiring those around her with her dedication and passion. Susan Kajura currently serves as the Executive Director of Bantwana Initiative Uganda. Glad to have you, Susan. You can turn on your microphone and say hi to participants.
Good afternoon, morning, evening, participants. Thank you.
Thank you. Our next panelist is Mr. Peter Kushemererwa, who is a qualified and proud social worker. He's currently serving as the SAFE project coordinator with Bantwana Initiative Uganda. And in his role, he supports program development, provides technical oversight during implementation, manages stakeholder engagement, reviews and develops training materials, delivers trainings, and supports the M&E function. Peter has over 14 years of experience in implementing community-based initiatives in child protection and safeguarding, economic strengthening, psychological support, and capacity building for vulnerable households and groups. Previously, he worked with Child's Eye Foundation as a senior practitioner leading the reintegration and reunification of children from residential care facilities back into their families under the Keeping Children in Health and Protective Families program. He also served with SOS Children Villages as a program officer, where he led the implementation of family strengthening initiatives and youth development interventions. Glad to have you, Peter. Please turn on your microphone and greet the participants.
Thank you so much, Alex. Good afternoon, participants and everyone. Good to be here. Thank you.
Thank you, Peter. Third is Jude Omonde. Mr. Jude Omonde is a statistician with a range of experience, over 10 years of experience working in monitoring and evaluation, and he's currently serving as a monitoring and evaluation officer at the AfriChild Centre. Glad to have you, Jude. Please turn on your microphone and greet the participants.
Thank you, Alex. Good afternoon, everyone. Glad to be here.
Thank you, Jude. Next is Twaha Ayebale Amoti. Twaha Ayebale is a researcher with the AfriChild Centre with over 8 years of experience working in child-focused research, working under programs that are focusing on evaluating the different outcomes of children and families and caregivers. He's currently working at the AfriChild Centre as a research coordinator. Glad to have you, Twaha. Please turn on your microphone and greet the participants.
Thank you, Alex, for moderating. Nice to have everyone join. Thank you.
Thank you, Twaha. Now, to make this conversation even more interesting, is we have Madame Lucy Otto. Madame Lucy Otto serves as an assistant commissioner in the Department of Culture and Family Affairs at the Ministry of Gender, Labor and Social Development. But before, she served as a principal social development officer at the Ministry of Gender, Labor and Social Development. She's passionate about family and works to strengthen communities. Many of us have seen her being instrumental in moving the journey of parenting in Uganda, supporting development of parenting standards and guidelines, manuals, and all the conversations around parenting. Madame Lucy, if you've joined, please turn on your microphone and greet the participants. Okay, I'm informed that she hasn't joined, but once she joins us, then we will welcome her to take us through the different pieces. Okay, so I'm going to start with Madame Susan Kajura. And in this segment, you're going to share with us what Bantwana is and a bit of the journey of Bantwana. And then after that, we will have Peter to talk about specifically the SAFE program and the SAFE model and how it has been implemented in the different locations. Over to you, Susan, and you are welcome.
Thank you. Okay, thank you, everyone. We were given 25 minutes to do this quickly. So I will just walk through the slides and just introduce everybody to who Bantwana is. In Uganda, Bantwana actually is in several countries, in about 5 sub-Saharan countries. But for now, we are Bantwana Initiative of Uganda. Next slide. Peter. Okay, thank you. So our vision is a world where children are safe and thriving, and our mission is to empower communities to protect every child through innovative strategies and advocacy. We ensure a safe environment and foster resilience for a brighter future. So our entry point is really in the area of child protection. Next slide. So Bantwana in Uganda has 3 major programs. Although we've been working for a while as a field office, but it's in 2023 that we became an independent entity in our own right with local registration. But before that, we were doing several USAID supported programs right across the country. But our organization now works in 11 districts. We have a teen mom program and a program that we call SAFE, which stands for Safety at All Times for Every Child. That program works in the 3 districts of Kabarole, Chenjojo, and Bunyangabo. And then we have the Real Fathers program, which is a parenting program that looks at IPV in young households, and that's in 8 districts in both the Bunyoro sub-region and in Soroti. So that's the green one for those who are not familiar with Uganda, and that's in the map. Next slide. So our approach, all our work takes a social ecological approach and to strengthen systems and work with caregivers to help children. So at the center, if you look at those concentric circles, are children, and then we look at the systems that support the children. So we start with caregivers. At the center are children and youth, so it's about building their agency. And then it's about working with those systems that help strengthen them and protect them, beginning with those closest to them at the household level, and then fanning out into community systems where we're looking at the institutions where children often are. We look at the local government systems. We look at the community systems that also influence and protect them. So that is really how we approach it. So it's a system strengthening approach, which has children at the center and helps them access the most essential services. Next slide. And in that is our whole community approach. But we use a social norms integration approach because we're looking really at our SAFE program, which has been built over 12 years around the Rwenzori region. And we developed this with the community. And ultimately, we were looking at ways to shift those harmful norms that affect children to strengthen those protection systems, especially the natural ones around the children, and promote their well-being. And we tend to work in the vicinity of schools or ECD centers and the communities that surround that particular area. So what we do is integrate into our manuals, and you'll hear a little more about our manual and approach, a social norm approach that was developed from several norm mapping exercises. This is really important because that, unless you're shifting norms which perpetuate violence, you're only addressing the tip of the program, of the problem. Next slide. So what do we mean by harmful norms? We're looking very specifically at those that perpetuate violence. And in our mapping, both in the country and in different areas, we found that there's some norms that are pretty persistent, where adolescent children, for instance, those who are out of school are already viewed as adults, even though they're children, they'll be treated as adults. When you get girls who are at puberty, both the peer pressure and the pressure from the communities to have sex comes into play for different reasons. There's systemic practices that perpetuate that. There's the entitlement of men and boys to sex without consequences. We're looking at, those notions of masculinity that are very much a part and are encouraged by, the social norms in any place. Then silence and stigma around child sexual violence disclosure is one of those norms that just perpetuates the shame that comes with this worst form of violence in many cases. And then assigning child rearing to women only and discouraging children from speaking up. So when we look at these norms, we address them through positive parenting as a principal intervention, which you'll look at the center of our SAFE toolkit, but it works very closely with children empowerment and community systems. But we want parents to critically reflect on norms and commit to healthier behaviors and strengthen protective family and community structures. So over to Peter, and that's just giving you the brief overview, but Peter will let you know how it actually works. Thank you.
Yeah, thank you so much, Susan. Alex, if I can continue. The SAFE program has 3 complementary manuals that make up what we call the SAFE toolkit that we work with to deliver in our communities that we target and work in. So the three complementary manuals really work together, first of all, to really ensure that we're promoting the prevention of violence against children, but also addresses the response part of it, like I will be saying below. So one, we look at which one is our key component is the positive parenting, where we have the caregiver and parents. So here we look at caregivers completing an 8 manual session that they go through for around 8 weeks. And it's basically meant to improve relationship between caregivers and their children as a tool or as a way of preventing violence against children, since they are able to detect violence early, improve communication, and they are able to respond. The other manual looks at teachers. We work in schools as SAFE is a whole community approach. So we work with schools as well to reach out to teachers who we deliver a sexual abuse prevention and response training. It targets both teachers and non-teaching staff in particular schools where we work with, ideally to be able to prevent, identify and prevent violence against children in schools, but also promote a safe environment for children while at school. But also it trickles back to communities because we look at teachers as caregivers as well. And the other manual looks at children and adolescents, where we adapted a skills-based curriculum, best really to improve the urgency of children and adolescents to be able to prevent violence against themselves, prevent victimization for those who are out of school, but also continue and be able to prevent and support others in case of abuse through reporting and early detection. So there is a continuation of our caregivers even after they finished the training. They transit into the VSLA plus groups, really to continue reflecting and building on the sessions that they've had, but also as a support structure. But also, all these interventions lead into our community strengthening systems, where we support the functionality of child wellbeing committees right from parish to the sub-county and later district. So how it is delivered, we deliver it at 3 levels, basically. One, where we work with NGOs and the district, where we train resource persons to deliver the manual, both the positive parenting manual, but also the SAPRT manual. We are also doing the community resources training sessions, where they deliver the sessions to the targeted caregivers, children, and also the teachers, where they have facilitator guides and job aids that deliver the sessions, but also the parents in the groups who continue to use the reflection sessions and to the job aids, but this one also happens for the teachers and for the children who transit and graduate from the skills-based curriculum training. So the complementary structures, we don't work in isolation. Here we are delivering it according to national guidelines and policy standards. For example, we work within the frameworks, for example, the positive parenting manual, but also the NCP, the National Child Policy, to guide the other implementation of activities. And also our BN manuals are practical curriculums, really. They are step-by-step showing how processes are done, but also engaging and participatory. So our really sessions across all interventions promote bonding, problem solving, budgeting, and safety for children. In other words, it creates a policy to practice continuum of implementation. And so how our safe toolkits and safe program links to system strengthening. and how the two are interconnected. Like I mentioned earlier, all the three interventions end up into the system strengthening that is able to involve the prevention, but also the response arm in case of violence against children, in case it happens. So at step one, we have the cases were identified, and these ones we identify them from schools, by teachers, by coaches who deliver the sessions to children, caregivers, and parasocial workers, who are the community structure we work with, of which if they identify cases, they are referred to the parish child wellbeing committees, where we have representation from both community and school at that level, and they are able to discuss cases, and complicated cases are referred to sub-county child wellbeing committees, where we have the CDOs, the sub-county senior assistant secretaries, the production secretary for children, police, and other opinion leaders, but also cases that beyond them and which they can't resolve continue to reach the district child wellbeing committees, where we have probation officers, police, COW, the DCDOs, and other key implementers. But also key to note is that child sexual cases, those are usually referred to the districts and police because of their mandate and legal. However, the different committees continue to provide support in terms of follow-up, in terms of psychosocial support, in terms of documentation, and contributing towards the evidence. However much the case has been forwarded to high levels, they continue to provide support along the way. So this is a snapshot of cases, which is one of the areas that we work with in the parish, that shows that some of the cases that we have seen, and of which we realize and seen that most cases that we've received at parish, documented and supported, the biggest are the neglect cases at 62%, followed by the GBV cases, which are around 9%, and also the child sexual abuse, which is at 22%, that these ones are documented and received. And then emotional comes in at 5% and physical at 2%. So it shows that the biggest cases that receive are the neglect, and which are really precursor to other forms of abuse, where child sexual abuse comes in handy, but also the physical and emotion. Thank you so much, Alex. That's what I can share. Thank you to everyone. Thank you.
Thank you very much, Peter, and thank you very much, Susan, for those insights. Susan has told us about Bantwana, and then Peter has also told us about the SAFE program. Now, it's one thing to implement, but it's also another to achieve impact. And the only way you can know that you've achieved impact is when you assess your intervention or evaluate it. So at this time, at this moment, I'll invite Jude to take us through the evaluation bit and the research bit of the SAFE program of Bantwana Uganda. Over to you, Jude.
Yeah, thank you very much, Alex, and Peter for the preamble. Good afternoon, everyone. My name is Jude Omondi, and I work at the AfriChild Centre. I work at the AfriChild Centre, and I lead the monitoring and evaluation function. I am happy to be here to share the findings from the study that we conducted about the safety at all times for every child program. So we shall quickly. Okay, so in form of a background, so we know that violence against children is a widespread global issue, and it affects an estimated 1 billion children worldwide. Sorry. Sorry about that. Okay, sorry about that. Yeah, so and specifically in Uganda, the 2015 National Survey on Violence Against Children also revealed a very dire. Are you able to see it on the screen? Also revealed very dire situation when it comes to violence against children. And then based on the different challenges at the global and national level, the Bantwana Initiative Uganda, like my previous panelists mentioned, launched the Safety at All Times for Every Child program. And this has been running for over 12 years. And by the time we were conducting this study, it had been implemented in 29 schools and their surrounding communities, and it focuses on children aged 9 to 14 years. So this study was commissioned in August of 2024, and the aim was to assess the effectiveness of the SAFE program in responding to violence against children, and specifically child sexual abuse within the schools and also the surrounding communities in those 3 districts in Western Uganda. So we had 3 specific objectives. The first one was to measure the changes in knowledge, attitude, and practices that are related to the different risk exposures to VAC, but also with focus on prevention and also response. And then we also assessed how the SAFE program aligns with the different community needs and existing structures and practices in the region. And lastly, we also evaluated the roles of the different stakeholders. And the focus there was on the caregivers, teachers, parasocial workers, and the community leaders in basically sustaining the gains that the SAFE programs offers. So specific to the outcome research, we used a mixed methods pre and post intervention design. Basically what we did was to compare baseline data that was collected in 2021 before the onset of this program. And we used the same tool to administer the end line, which happened this year in March. So to a very big extent, the tools had looked almost the same, apart from some additional questions that we needed to explore more. And in terms of sampling strategy, it was purposive. So we targeted the 10 schools that participated in the baseline study at the onset of the program. And then for the data collection methods, we used different methods, the key format interviews. We had also the in-depth interviews with teachers, coaches, and school administrators. We also had some focus group discussions, and we had 2 sets of surveys that we administered to caregivers and also the children. For the data management and analysis, we used, especially for the surveys, we used Kobo to collect the data, and then we used SPSS for the analysis. For the analysis strategy, we used cross tabulations and comparisons of the proportions between the baseline and outcome studies. Of course, we tested for statistical significance using the Pearson chi-square test at the level of 0.05. That's for the quantitative data. And then for the qualitative, we used in vivo 20 and within the framework of we used in vivo 20 to do the coding and also generate thematic kind of frequencies. So in terms of the findings, when it comes to the participation, empowerment, and knowledge, we found out that the SAFE program enhanced the participation of caregivers into the different savings groupings, into a different savings group, sorry. And that rose from 63% to 97% at endline, which was significant. And in terms of the parenting training, again, we saw a very big leap that at baseline, only 39% of the parents said they had attended different parenting trainings, but at endline, that rose to 97%. And for the children, 77% of the children had enrolled in different school clubs. And like Peter was mentioning, in those clubs, there are different activities that they get exposed to. We also see that schools became actually the primary source of child rights information. And that is demonstrated by the numbers. So when you look at the knowledge and practice, the children's rights awareness among children increased from 97% to 99%, which was also significant. Children were better able to recognize verbal abuse as harmful practice, and that also saw a big and significant rise. The belief that caning motivates learners reduced. At baseline, 48% of the people who were interviewed had said caning actually is okay, but at endline, we see that only 32%, which we see is a significant reduction. Again, knowledge of child sexual abuse as an illegal act by teachers also increased. This question was specifically to the learners, and were able to have better recognition of CSA as being an illegal act. And like our executive director mentioned, this is a social norms change program. So this program specifically targeted 4 negative social norms throughout the 3 years of implementation. And so we asked questions regarding whether the caregivers actually agree or disagree with these social norms. Overall, we saw that there is a positive shift in the caregivers' attitudes towards the harmful social norms. So specifically for the 3, for example, the norm that respectable girls should experience sex before marriage, we saw that caregivers who disagreed with that statement increased from 15% to 42% between baseline and endline. And then the norm about a man to be considered peers by his male relatives, he needs to have sexual intercourse. We also saw a big change with 89% disagreeing compared to 77% at baseline. And then the unmet needs of basic needs. Girls who have unmet basic needs are expected to look for men to to take care of them. We also saw a shift. And lastly, about how parents allow children to express themselves, where we see more parents allowing that it's okay for children to speak up and also express how they feel. In terms of safety in schools and communities, we see that children's sense of security improved remarkably, with significant improvements between baseline and endline. Specific at the school level, up to 79% of the children who responded said they felt safer at school, compared to 49% at baseline. And so that's at the community level, and then 89 to 92 at school level. So from the qualitative piece, we also picked information that this sense of safety contributed to a very big decline in school absenteeism due to fear, with absenteeism dropping from 26% to 9% between the two time periods. Of course, we had a question that asked whether they had actually missed school during the term, and if they missed, what was actually the reason. So based on that, we saw that absenteeism actually reduced between the two time periods. So we also recognize that this is contributing to better completion rates, but also coupled with the parents being more supportive by providing scholastic materials and all that, we believe that that is having very positive education outcomes for the children. We looked at also disciplinary methods being used by the caregivers, and we saw that overall, caregivers' disciplinary practices are shifting towards the positive, practices. And we see here the numbers. For example, the three highlighted are the ones with asterisk. The proportion of parents who shout or yell, stroke scream on the children reduced from 58 at baseline to 29. Knocking the head of a child, we also saw a reduction, but also we see a significant improvement in the number of parents who report that actually they don't punish their children. For the disciplinary methods, again, we see that parents report that they are adopting more positive they're adopting more positive disciplinary measures. For example, using counseling and guidance, and also cautioning the children as a replacement for the previous and hard core ways in which they were actually punishing the children or disciplining the children. So we have a quote here, for example, one caregiver in Bunyagabu who said, after learning the 9 parenting sessions from Bantwana, I always provide guidance and counseling to my children so that they can grow as responsible adults. And we had so many of these voices coming from the different focus groups, and also the in-depth interviews that we had with caregivers and teachers. Of course, the second objective around the study was on the alignment of the program with the needs, norms, but also the government structures that currently exist. Especially from the key informat interviews with the district leaders, we saw that there is a strong contextual fit and integration between the program and the needs of the communities, but also the different government programs. This was mainly informed by the inclusive consultation that the Bantwana team did at the beginning of the design. We also see alignment with the positive social norms. I think it was Susan who mentioned that at the beginning, through the program, they conduct a social norms mapping where they identify best or positive social norms, and through the program, they try to promote those. And this is done through the different activities that are actually highlighted here. We also see that the alignment with stakeholder needs. This program tackles very key community issues: sexual violence, child marriage, harsh discipline, and poor parenting. These are actually needs that were very evident at the community level. And like we shall see in the communities, in the recommendations, there is still even need for, to continue targeting those different changes. In terms of policy and structural alignment, we see that, of course, with literature review, we saw a very close alignment between the program and also the Children's Act and also the National Child Policy of 2020 of year 2020. So in terms of sustainability, we identified some best practices that will enable this program to remain sustainable. Specifically through the VSLA, the parents have established an OVC fund that is supporting children with different needs, specifically scholastic materials. We believe that if they continue with that, it will be helpful in sustaining the benefits of this program. Collaboration with government is key, working with the different stakeholders as they're already doing. We believe that if they, they continue harnessing the connections that they've already built with the parasocial workers, the community development officers, and the different coordination committees at the district level, it will help, to sustain the benefits that the SAFE program has given. And then through the school clubs, we noticed that there's a lot of peer-to-peer support, especially when it comes to discussing issues of violence, specifically sexual abuse-related violence. And so we believe that that is also a platform that the program at exit should be able to strengthen and leave them in a way that they can be able to sustain. Of course, from the teachers, we also got commitments where they said, of course, there is need to continue refraining from abusing children and to respond appropriately to the reported cases. And these are some of the verbal, again, the qualitative quotes from Bunyangabo. And then for the recommendations, we looked at 5 main recommendations. One is the issue of integration, where we see that there are components of the program that we should be able to scale within the existing national child protection and education systems. Specifically, we also noticed that, especially at the district level, the leadership at the district expressed the need to scale this program to more schools and also communities. And in terms of strengthening systems, the need to enhance the referral and case management mechanisms came out very strongly, because there were cases where we found out that communities, even when they were responding, they needed support services from the different actors. And then community engagement needs to be scaled up, specifically targeting cultural and religious leaders to shift the harmful social norms. And lastly, we are looking at also conducting, if resources allow, we propose that we should conduct more impact evaluations to examine the causal pathways and long-term effects of this program on violence against children. So in conclusion, overall, this study acknowledged that the SAFE program is a very powerful blueprint for tackling violence against children in and around schools. And it serves as a very promising intervention with potential to improve VAC programming and policy across Uganda and also in similar contexts. Of course, we have the key results of these interventions are the empowered children and caregivers, the adoption of non-violent parenting and teaching practices, reduction in the harmful social norms and gender equality, and also stronger school and community-based protection systems. So this is the end of the presentation. But just to note that there is a bigger report that maybe our moderator can speak more too. Thank you, and back to you, Alex.
Thank you very much, Jude Omondi. Thank you for giving us those insights, and thank you for sharing findings from the evaluation conducted on the SAFE program that was implemented by Bantwana Uganda. And as we all heard in the beginning about Bantwana and about the SAFE program, we now know that the SAFE program, we now know from the findings that the SAFE program changed a lot in the communities where it was implemented. But as I promised you, our participants, viewers, and listeners, I promised you that before we even move away from the findings and the entire program, we need to have a context of all this, what this means for the government, what it means for the practitioners, and what it means for anyone who is in the field of implementing parenting programs and programs which are looking at improving outcomes for children, but also outcomes for caregivers, outcomes for teachers, following the socio-ecological model that Madam Susan presented. So ladies and gentlemen, allow me to invite our discussant, Madam Lucy Otto, who is the Assistant Commissioner, Department of Culture and Family in the Ministry of Gender, Labor and Social Development, to give us context on what this means. What does this mean for parenting programs in Uganda? What does it mean when it comes to improving the lives of adolescents, the lives of children in the country? Madam Lucy Otto, I'm inviting you to talk about the policy spectrum, but also practice when it comes to parenting in Uganda, and what the SAFE program and maybe the other programs that you've interacted with mean for the future of this country. Over to you, Madam Lucy.
Thank you. Thank you so much. Good afternoon, everyone. Good evening. My name is Otto Lucy, Assistant Commissioner, Family Affairs. On the 1st of September 2025, the Parenting Agenda Technical Committee sat and reviewed the documents on positive parenting program that was developed by Bantwana Initiative. It's the role of the government of Uganda to play an oversight role on promoting evidence-based parenting programs. And at this point, I would love to say that the Ministry of Gender has approved yet the third evidence-based parenting program in the country for scale-up. The first one and the firstborn of parenting in Uganda is Parenting for Respectability, which is implemented by Makerere University Child Health and Development Center. The second one is Real Fathers Program, which is implemented by IIDC, developed by Save the Children. And the third and the youngest one at the moment is the Positive Parenting Program developed by Bantwana Initiative Uganda. We went through the outcome study report and the Positive Parenting Training Manual developed by Bantwana. We also went through the Facilitator's Guide and the Positive Parenting Job Aid. We had a number of documents to go through because we wanted to see whether they actually measure to the national standards we developed as a country to ascertain whether a program qualifies for scale up in the country. So after subjecting the positive parenting program documents to the 8 national standards for parenting program in Uganda, we actually unanimously agreed and approved the positive parenting program for Uganda as one of the parenting programs for scale up in the country. That means Bantwana will no longer confine themselves to Western Uganda only in the districts of Kabarole, Tenjojo, and Bunyangabo. After going through the eight standards, which includes after the first test of being evidence-based practice, SAFE program went through this. The second one is on sound theory of change. SAFE program went through this. The third standard is a tailored program content. Still, with the 8 to 9 sessions, they went through this. The next standard is a strong program dose. They still went through this. When we look at appropriateness and accessibility, where are we going to deliver, who, within what time, for how long, SAFE program still went through this. Then when we look at the competence of the staff to deliver, we still found that they're highly qualified, including the team that conducted the research, AfriChild. And still they're also using the district technical team, the CDOs, who are professionals and are trained by government of Uganda. On inbuilt research and monitoring and evaluation mechanism, it also passed through it. They have all the components. The program was evaluated. That is what was covered in the report. And it showed clearly how they can achieve our objective of reducing violence against children. And finally, on sustainability and scale up, we found that the SAFE program is using the existing government structures of the CDOs, the para-social workers, and the child well-being committee. They also form school clubs, and they're using a peer-to-peer support, which is an approach that has been adopted by government of Uganda for promoting programs, especially for children and youth. And also it passed the sustainability tests. So seeing that the SAFE program has got a tick of 8 out of 8, the Parenting Agenda Technical Committee approved this SAFE program, the Positive Parenting Program as a program for scale up in Uganda. So we are going to send an official circular to the districts to receive scale up of 3 programs at the moment. Parenting for Respectability, Real Fathers Program, and the Positive Parenting by Bantwana. Earlier on, we used to do things haphazardly, but now we are under Parenting Agenda Initiative. We are getting a bit organized with the support and guidance of the national standards on parenting program. We are able to give guidance both at national and sub-national levels. Before any program is implemented in the country, we have the Parenting Agenda Consortium, which goes through the technical committee. So for approval, when the technical committee says it's okay, it means you've been given a go-ahead to implement and to scale up, because it means it has gone through our test of the national standards, the 8 standards. Very happy to be part of the implementation team. And as government of Uganda, we pledge to support the scale up of SAFE program from 3 districts to 30 districts in Uganda. Thank you so much.
Thank you very much, Madam Lucy Otto, Assistant Commissioner in charge of Family Affairs. at the Ministry of Gender, Labor and Social Development. And those are very, very good insight to see that where we are coming from and where we've reached. Some of the programs, parenting programs, have been approved, and districts are free to even scale them up. But also, what that means is that even other partners who might want to adapt or adopt some of these programs, then they can ably and easily reach out to Bantwana to also scale up and give the necessary support. But also hearing from a commissioner and then linking her submission to the first submission we received from Susan Kajura, it also indicates that, in fact, Bantwana has 2 programs now that are approved nationally, because she mentioned that Bantwana has also been part of implementing the Real Fathers program, and now the SAFE program. So that is a big achievement, I think, and congratulations to the team. So this time we are going to invite questions, and feel free to type the questions in the chat. We have a few minutes to discuss them. And I will first read the questions that are already in the chat. I see Mr. Herbert Mosisi asking Jude, I want to know the composition of the parish welfare committee. Jude, that is a question to you. I know Peter also talked about this. Maybe you will answer it together. And then we have a question again from Mosisi Herbert. Why did you find it difficult to also form a village welfare committee? So the feeling is that we have committees at the parish level, but not at village level. So why did you find it difficult to also form a village welfare committee? And this also might go to Peter, or Judy and the team. And then Mr. Dennis Mahanje asks, I note that caning as a means of punishment by caregivers has hardly reduced, only from 47 to 46%, and it remains one of the main models of punishment. Are there any deep-seated reasons why this form of punishment is persistent? This is a question to Jude, especially on the finding, but also Peter or the Bantwana team can also talk about whether there are any other reasons that we might want to know or talk about as we aim at reducing these forms of punishments. And then Mr. Musisi Herbert again comes and says, to avoid selection bias, how did you draw a distinction between a parasocial worker, a TBA? I don't know. I was about to call them traditional birth attendants, but I don't know whether that is what Musisi means, and a child protection committee members that you enrolled in the evaluation. Otherwise, thank you for the presentation. So I'll invite Peter first to talk through the questions that we have so far, and then Jude will come also on board to say some things. Then Twaha to also say some things, and then finally I'll invite Madam Susan to also speak to any of the concerns that have been raised, as we see whether there are more questions in the chat. Over to you, Peter.
Yeah, thank you so much, Alex, and thank you for the questions. One, take response. In terms of the composition of the parish child wellbeing committees, these they have the parish chief, We have the VHT representing. The schools are represented by patron or matron. We have the VHT. We have the local leader representative. Here we are basically looking at the LC1 or any secretary for children affairs at a village level. And also we are looking at, there are 7: parish chief, opinion leader, an LC representative, a VHT, parasocial worker, the school patron or matron, and the parish chief, who is the chair. And on if we found any difficult in forming a village welfare committee, the issue is no. As BIU, we promote and support transitioning caregivers who graduate from positive parenting to transition and form the VSLA plus groups, or what we call also the positive parenting groups. So these groups look at the general welfare of the children. One of the biggest components they have is the OVC plus, which is a grant given to children, OVC children within their communities and at their discretion to support access critical services like health, nutrition, or scholastic. But also, they are supported by the parasocial worker who is trained and in constant with the other committee members at parish and sub-county. For parish, it was previously, actually, we had what we called the village child case management committees, but with guidance from the Ministry of Gender, these ones were elevated to parish level to align more to the government systems and structures, where we have the parish chiefs now hosting and responsible for them, but also helping in integration of child protection issues in the other roles of parish chiefs, other than only being in charge of government programs like the local service tax management and all that. But now this one really integrates the child protection interventions into their roles. That's my take, Alex, on those 2 questions. Over to you.
Thank you, Peter. Jude, do you want to come in and specifically start with the question on corporal punishments, specifically on caning, and what your thoughts are?
Yeah, thank you, Peter and Alex. So, yes, maybe just to give the context to the 47 and 46. So there was a question, a screening question of whether they had been caned or not. So out of the 240 that we interviewed, about 114%, sorry, about 114 said they were actually caned. That's the children saying. But then there's also a follow-up question on the frequency. Some kind of like to help us establish like the severity of this, caning. And the good news is that we saw a big shift from baseline where about the 47, most of them had said always. But at end line, there's a bigger percentage saying sometimes. So I think there is a positive kind of shift. Of course, complete elimination would be the most ideal, but I think with this gain already, I see that this is something that we need to, it's a gain that we can build on. Yeah, I think that's the main comment I wanted to make regarding the corporal punishment. Thank you. I think Peter responded to the other programmatic questions well. Yeah, back to you, Alex.
Thank you very much, Jude. Thank you very much, and I hope Dennis Mhanji, this also answers your question. Okay, the other question was still on corporal punishment by Bess Herbert from ISPCAN. I hope you now feel better that you've been answered. And then Esther Bot says, thank you so much for a fascinating and hopeful presentation. I'm working with the AfriChild Centre on a project that is exploring girls or young women's experiences of anti-trafficking rescue from the orphanage tourism sector in Uganda. Does your work ever cross to orphanages? And do you have any insights that might be helpful to us as we conduct our scoping review prior to the qualitative research? Thank you. This is from Esther Bot. And then Patrick says, I would like to thank Bantwana Initiatives Uganda for the SAFE program and kudos for the report and for highlighting the success stories of the program. The recommendations are also okay. However, on strengthening the systems at community level, I would say that the LC1 vice chairpersons should be guided to be more proactive in combating violence against children because they are officials responsible for children affairs. This is from Patrick Osiko Idoke. Peter or Susan, do you want to start with this last question, and then Jude will talk about whether AfriChild work crosses to orphanages, and then whether we'll be able to assist Esther Bot with the different literature. Over to you, Peter.
Yeah, thank you so much, Alex. Yes, in terms of strengthening communities, we work with LOC1. Different interventions engage LOC1s at different levels. One, we have the community dialogue meetings, which are rotational and hosted in different communities, where the LOC1s are part of the community dialogues. In terms of, we also reach out to them, but maybe just to give a context, LOC1s in Uganda are playing different roles, really. Sometimes we have LOC1s who are supporting, but they are working as parasocial workers. We are seeing LOC1s who are VHTs. So to us, they are a resource in terms of, and we try to profile on the different roles they provide and play in their communities. So we target them at different levels. Yes, it's something we try and always implement. But where we have direct implementation, like community dialogues, positive parenting, we have LC1s who are participating in it. And the case management comes in really when they are onboarded into the parish child wellbeing committees, and which at school level. Currently, we work with a total of around 62 parish committees, and each one of these has an LC1 represented, or the voice represented there. So it is something they are integrated into, though we may not have a direct kind of activity that's targeting them, but they are integrated into our interventions and programming in one way or the other.
Thank you very much, Peter. Jude, do you want to talk through the previous question from Esther Bot?
Yes, thank you, Alex. Yes, Dr. Esther Bot, yes, we have some piece of work around child trafficking, child labor. So yes, we can explore more. I think you should be able to reach out to the center through the executive director to see that more. I'm just curious to know if she also wanted to find out if Bantwana is also doing similar work. If she's still online, maybe she can provide more clarity on that.
Okay, thank you, Jude. Since Esther Bot has already mentioned that she's working with the AfriChild Centre on a study, then we can defer that conversation offline, and then just reach out, and the team will be able to support you as Jude has guided. Dora says, I appreciate the efforts shared by Minister of Gender, and my appeal is that as stakeholders, we roll this out to promote these initiatives. Thank you very much, Dora, for that comment. Ladies and gentlemen, listeners, viewers, participants, colleagues, we are coming to the end of this webinar. And just as a way of ending it, let me just give a quick summary. We started by listening from Madam Susan Kajura, who is the Executive Director of Bantwana Initiatives Uganda, telling us about Bantwana, its history, and what it does in the country, especially highlighting the SAFE program and the Real Fathers program. After that, we listened to Peter Kushemerwa, who also works with Bantwana as the project coordinator, the SAFE program, and dived deep into what the program does and what it has done and how it has done it. After that, we listened to Judy Omondi, who works at the AfriChild Centre, that led the evaluation of the SAFE program, who also gave us insights, especially on the findings that the AfriChild Centre was able to generate on the program. And later on, we listened from Madame Lucy Otto, who is the Assistant Commissioner, Family Affairs in the Ministry of Gender, Labor and Social Development, who also gave us insights, but also to most importantly, mentioned that the SAFE program and its approach is one of those 3 so far approved programs by the government of Uganda to be scaled up in the entire country, and mentioned that the Parenting Agenda Technical Committee has approved the program, just like the Parenting for Respectability and the Real Fathers. Ladies and gentlemen, that is a quick summary, and we pray that we hope that you've enjoyed the discussions, you've enjoyed the presentations. So as I summarize, I just want to give my speakers and my discussant 30 seconds each. And I'll start with Jude, then Twaha, and then Peter, and then Susan, and then Lucy, in that order. Over to you, Jude. In 30 seconds, what are your parting shots in this? And what last words would you want the participants to listen to?
Yeah, thank you very much. Thank you, Alex. And I want to thank everyone for joining in. For us at the center, as we indicated in the recommendations, I think there is still an opportunity to continue gathering more evidence to establish the more rigorous causal pathways and things like that for the different, not just for the SAFE program, but for the different other programs that we are currently implementing as a country. And as a center, I am sure we are happy to partner with any stakeholder to do that. And thank you all, and have a good evening.
Thank you, Jude. Twaha, in 30 seconds.
Thank you, Alex. Thank you, team, and everyone for joining. Basically, from my end, when you look at most of these child abuse cases originate from our own norms and traditions we live in. For example, if you see a boy to be considered a man needs to have sex, a girl with unmet needs are expected to find a man to care for them. So basically, I feel that let's not wait to be parents. Let's not wait for these things to happen to our sisters and brothers. We have a role to play. Let's act now. We know our societies, we know our norms, and we know how best we can start to address these aspects. Thank you, and bye.
Thank you very much. Peter, over to you in 30 seconds, your parting shot.
Yeah, thank you so much, Alex, and thank you to everyone who has been on the call and on the webinar. Well, my parting shots that it takes everyone, and all of us have a role to contribute towards the prevention and response to violence against children through our various positions that we hold, even beyond the offices. But it would be good. I usually love the role parasocial workers play, that I would wish that all of us in our communities be that positive bystander to be able to champion and promote a violence-free community for our children. Thank you so much. And over to you.
Thank you very much, Peter. Madam Susan Kajura, over to you for parting shots in 30 seconds.
Thank you everyone, and thank you AfriChild for this platform. I think my parting shot is similar to Peter's. I think violence against children, and particularly the worst form, child sexual abuse, is preventable, but it will take collective responsibility and accountability, working together as we're doing at these different levels. And to thank everyone for appreciating this and coming together around this important issue. Thank you.
Thank you very much, Madam Susan. And lastly, Madam Lucy Otto, what are your parting shots?
Thank you, Jude. Thank you, Susan. Thank you, the entire Bantwana team. And thank you, participants. Now, Bantwana, go and preach the gospel of positive parenting and scale up your program from 3 to 30 districts. Move from the north to the south, to the east, to the west, because you've been given the blessings by the government of Uganda. Thank you for what you're doing.
Thank you. Thank you, Lucy.